Hey everyone, have you ever faced CLIA denial and feeling stuck? These denials can be frustrating, but they are avoidable with the right knowledge. In today's video, we are going to break down what is CLIA and why this denial happens and what to do after getting this denial and how to prevent this denial in the future. If you're new to this channel, please click the subscribe button below this video so you get notification every time whenever I post new content, helping you to stay updated and improve your skills in this field. Join our community and let's grow together. What is CLIA? CLIA stands for Clinical Laboratory Improvement Amendments. It's a set of federal standards ensuring that laboratories maintains high quality testing standards. If your practice performs lab tests, you need to get a CLIA certification and a CLIA number. Now let's see what is CLIA-waived test. These are simple lab tests that are approved for low risk of errors or home use. For example, blood glucose test and urine pregnancy test. These above tests does not require CLIA certification, but you have to add QW modifier. The modifier tells the insurance that the test meets the CLIA-waived standards. Why does CLIA denial happens? There are three main reasons for CLIA denial: missing or incorrect CLIA number on the claim form, missed to add QW modifier for the CLIA-waived test, the test performed is not covered by the provider's CLIA certification type. If you are a healthcare provider and receiving a lot of denials and you need a helping hand, you can contact me. I'm a certified professional coder and biller. I can help you to grow your business. How to resolve this denial? Once you get the EOB or ERA, make sure it's a CLIA denial. Then check whether it's a CLIA-waived test or CLIA test. If it is a CLIA-waived test, then you have to add QW modifier and refile corrected claim to the insurance company. If it is not a CLIA-waived test, then you have to mention the correct CLIA number and refile a corrected claim. Make sure that the CLIA certification is active during the date of service. In case the CLIA certification is already expired or going to expire, contact your provider immediately and inform them to update the CLIA certification. How to prevent CLIA denials in future? Before submitting your claims, make sure that you have added CLIA number for your claims. If it is a CLIA-waived test, make sure you have added a QW modifier for lab test. Keep your CLIA certification current and ensure it covers all the services you offer. Provide training to your billing team on CLIA requirements and CLIA-waived test to avoid submission errors. I hope you like this video. Follow me for more medical billing and coding related videos. If you want any denial topic to be covered, please mention in the comment section. See you on the next video.